Today we're going to talk about hair embryology, hair anatomy, and hair physiology as it relates to the hair growth cycle. We're going to briefly sort of go through each of these components so you have a better understanding of some basic science in regard to hair anatomy and cycling. As far as the embryology, let's just briefly cover this so you understand sort of how a hair grows during fetal development. Around the 10th week of gestation, the primitive dermis or mesenchyme has the primitive signals that originate from the dermis and go upward toward the epidermis, and that stimulates the creation of epidermal placodes. These placodes are where the hair follicles will develop. Then what happens is these placodes then come back and stimulate the mesenchyme or primitive dermis to create a dermal condensate, and this dermal condensate then stimulates the creation of a longer segment called the follicular peg, which is almost the full length of a hair shaft or hair follicle, and then that eventually matures into the bulbous peg, which has the shape of a mature follicle. So essentially, in summary, there's this ongoing interaction between the dermis and the epidermis to create the signaling that will generate a mature follicle. So I think that's all we need to know about embryology. Let's talk about basic hair anatomy. The way to think about hair anatomy is dividing it both horizontally going outward as well as vertically going upward. Let's talk about perhaps a vertical orientation. So taking a hair follicle and transecting it upward, what are the various regions? There's two major regions: the bottom portion, which goes from the bulb up to the isthmus, the central part of the hair follicle, and then from isthmus up to infundibulum. And the bottom portion is the non-permanent area where the hair is undergoing cycling. Through each hair cycle will degenerate and come back. And the upper portion, the isthmus and infundibulum, is a portion that tends to stay permanently throughout the hair cycle without change. So let's break those vertical components further down. So we'll take the bottom portion, the non-permanent part, and we can subdivide that into the bulb and then the suprabulbar region, and those areas are where the hair is actually dividing and growing through the matrix cells that sit in the bulb region of the hair that generate and create the hair shaft, the inner root sheath, and the outer root sheath, which we're going to talk about for the horizontal dimensions. In the permanent part of the hair follicle, it extends basically from what's called the bulge region, and we're going to talk about what the significance of the bulge region is more in a moment. That's, first of all, where the erector pili muscle inserts, and from that portion, the bulge region, that includes the isthmus and infundibulum. This is the area that, if you look at the isthmus, that extends from the bulge up to where the sebaceous gland inserts, and then the sebaceous gland entry up to the skin surface level is known as the infundibulum going outward, which is really just lined by normal skin. The bulge area is significant because that has now been found to be an area where there are stem cells that help regenerate the hair follicle. And the bottom portion we talked about in the embryology, the dermal condensate, that becomes the mature dermal papilla. And the dermal papilla, which is an invagination of the dermis, causes growth of the hair follicle. And what the thought is, these two areas, the bulge and the dermal papilla, work together. The dermal papilla is thought of as the inducer of hair growth, and in terms of the hair length and the hair caliber, and that interacts with the bulge region in terms of, they think of it as a responder, so they work as a team to grow that follicle upwards. The hair can also be divided anatomically going from inner to outer. It's like concentric circles that work out. It basically is the hair shaft, the inner root sheath, the outer root sheath, and a connective tissue sheath that goes around that. So those are looking at the hair shaft going outward. The inner portion, which is the hair shaft itself, is then subdivided into the medulla, the cortex, and the cuticle. The medulla is not always present in the terminal hairs, the thicker terminal hairs, and it's absent in the small vellus hairs. We're going to talk about the distinction between those two in a moment. The cuticle is like shingles of a roof. They actually aim upward, and they interlock with the cuticle of the inner root sheath, so that there's a scaffolding and a strength to the hair as the hair goes upward. The inner root sheath is then subdivided into what we just talked about, the inner cuticle that's interlocking with the hair shaft cuticle, and they grow up in unison as the hair shaft grows. The Huxley's layer, which is a few layers thick, and then Henle's layer, which is 1 layer thick, and those have a keratohyalin type of granules that cause the keratinization, which is different from the type of keratinization that occurs on the skin surface. But that keratin is so important because it creates rigidity. The best way to think of the inner root sheath is like a scaffold through which the hair shaft can grow and maintain its caliber going up. And there are differences in the cuticle of the inner root sheath between the different races. The inner root sheath continues to go up and really dissipates about the level of the isthmus layer, where from the isthmus layer going up toward the sebaceous gland, there is no more scaffolding or inner root sheath scaffolding. It becomes the outer root sheath scaffolding, which then turns into the epidermis. And the outer root sheath, as the final part we're going to talk about, is basically goes all the way from the bulb region and extends all the way out. And as I said, it goes up and changes into the surface epidermis. At the region of the isthmus, the area that we just talked about, where there's no inner root sheath to be had, the outer root sheath is the thickest there, and it's the thinnest toward the bottom at the bulb region. Let's talk about the differences between a terminal hair and a vellus hair. In general, our body has about 5 million hairs, and it's all over our entire body except for palms of the hands, soles of the feet, portion of the genitalia, and those are the areas that tend not, and the lips don't have any hair on them. But basically, all that hair is vellus, tiny little hairs, compared to the thicker terminal hairs. And at puberty, the thinner vellus hairs change into terminal hairs in certain secondary sexual characteristic areas, such as the pubic region and the axillary areas. So what's the difference between a vellus hair and a terminal hair? What's the significance? Well, let's compare those two and have you understand this. A terminal hair is what you see on a normal scalp. It's a thicker, dark hair that has a long shaft that continues to grow very, very long. And the vellus hairs are very, very thin. The thickness of a terminal hair is about 70 microns versus about 30 microns for a vellus hair. And the terminal hair can grow feet long, whereas the vellus hair tends to grow about 1 to 2 centimeters long, and anatomically has a very, very thin outer root sheath compared to the thick outer root sheath for the terminal hairs. And the clinical significance of vellus and terminal hairs is you can have vellus hairs go into terminal hairs, as we talked about during puberty. It's also a condition that can occur in people that are born with a lot of terminal hairs, such as in the syndromes of hypertrichosis, but usually that's more the lanugo hairs of birth becoming more terminal hairs. And then what's more important than all of that is the change from the thick terminal hairs into vellus hairs, a process known as miniaturization, which is one of the principal hallmarks of androgenetic alopecia or male pattern baldness. So we always think, when we think about male pattern baldness, obviously you just lose all your hair. It's actually, yes, you do have a shorter anagen phase where you're starting to lose your hair, but you're also, the hairs are being converted to these baby vellus hairs before they're gone through a process of miniaturization. So that's an important element of thinking about terminal versus vellus.